health and a little wealth and a lot of love.
A high consumption of ultra-tasty, hyperpalatable food, mostly in the category of junk food, drives calories into a surplus for people over days and weeks and months and years, and they get much fatter. Hormones up, hormones down, doesn't matter. You eat tons of junk food, you get into caloric surplus, you will gain fat in almost every case. Your hormonal status is not really pertinent to that in almost any meaningful extent. Bodybuilders take loads of hormones, the non-drug tested ones, of course, but what do they do to get their leanest? They don't just take hormones. That has absolutely a very big effect on what they look like. But the biggest effect is diet.
That's a lot to unpack. And if you guys are not watching us on YouTube or Shorts or TikTok or Reels, Emily shook her head. So I'm sure she had a lot to say about this. So what is your refaction?
So this is an exercise physiologist. He has a PhD, I think, in exercise physiology or something along those lines. And so
shout out to you guys. We're not undermining you.
No, and I think that there's a lot to be said about that. Obviously, one of the biggest problems in our country is that we are eating ultra-processed foods in abundance and we are sedentary. And obviously that calorie balance is important, but to make the gross generalization that there's no impact of hormones on weight gain or weight loss or muscle gain, muscle loss, I think is a generalization that you can't really make. I think maybe in the general public, you can sometimes make that statement, but even then, I think it goes away from my kind of functional medicine perspective of things, that the patient is an individual, and you have to consider all of the things that are impacting weight gain or weight loss, because everybody's different. And to say that hormonal imbalance, especially for females, is not something that impacts your ability to lose weight or gain muscle, I think is an incorrect assumption.
Yeah, especially when a man is saying that. Mm-hmm. I'm a big fan of this. Men should not tell women how they should drive or impact their bodies. And what I'm hearing, if I play that back to you, generalizations are never really a safe thing.
Yeah, I don't like generalizations in medicine at all.
You don't. In fact, Emily is a big believer of trust but verify. In fact, in our own relationship, if I tell her I do something, she'll go behind me and verify that I did it. And that's not an Emily thing.
Maybe I have trust issues, but it's
great.
But it's the first thing that we learn in medical school is trust but verify, because you have all of these journal articles and all of these claims that this is something that is clinically relevant, but is it really clinically relevant? And who's paying for this study?
Exactly.
And what's the data behind it? Is it statistically significant? Is it not? What are the confounding factors? There's so much that goes into
there is
research.
Yeah, and honestly, this is why Susan's Gross podcast was created, because there is so much information out there. Mm-hmm. There's so much, just especially on this topic specifically, and we want to allow you guys to have access to quality information. Emily went to med school for 4 years. She went to residency for 3. She's a practitioner for 2 years. 3 years, excuse me. Yeah. She is double board and also pursuing her other. So she has a lot of education. But education's great, but if you push that aside, she has a lot of practical experience, what her patients are asking. So I tell you guys this is where you want to come for quality information. In fact, for this specific episode, Emily has done 10 hours of research and scripting on this. Number one, it's one of her passions. And number two, there's a lot of the stuff out there. Like you have an MD going out there, excavating information and fact checking and making sure it's quality. So yeah. Well, anything else you want to say on that?
I mean, I think we're in this era where there's so much access to information, and there are so many professionals that have
she just did air quotes, guys.
that have different opinions And even within the medical field, you have traditionalists, you have functional medicine specialists, you have some integrative specialists that kind of combine the two. You've got chiropractors, you have, physical therapists, you have athletic trainers, you've got nutritionists. I mean, there's so many opinions out there.
That's right.
And there's only so much evidence, but even that evidence you kind of have to apply practically, because we don't live in a silo. There are people who are going to have issues with compliance. There are going to be people who have had, trauma in their lives that respond to medications differently, or respond to concepts or kind of motivational interviewing whenever you talk to patients when they come into the office. So we really need to move into more of an individualized approach, and I think we'll talk about that a little bit more.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.